Hello, everyone. My name is Ryan. I work at ABC for Health, and today I'm joined with Brynne. Today we'll be walking through the Healthcare.gov marketplace, previewing plans
now that open enrollment is here.
Right.
So we're not going to show you today how to apply for health coverage. You would actually go to Healthcare.gov, hit on the green button that says take the first step to apply if you're ready to sign up for coverage. But a lot of folks don't yet know what their options are. So we're going to take the couple extra steps to show you how you can do some window shopping. You can preview plans and prices in your area and get an idea of what plans you might be interested in. You know, if people are more organized in advance of going into a marketplace application, it's going to go faster. Have some important information handy. Your dates of births of people in your household, income of folks, your total household income, a couple other things like social security numbers. Get all of that organized in advance and do this window shopping so you can get an idea of which plan you want to purchase. Then it'll take less than an hour when you actually fill out your complete application for healthcare coverage. You're going to do a two-part application. You're going to apply for financial assistance first, and then you're going to finish your actual purchase of your plan second. But let's not get in too far ahead of ourselves. Let's just shop. So you're going to type in healthcare.gov right into your web browser. All web browsers work just the same, so you don't have to pick one over the other. Healthcare.gov. And you're going to get to this main page. And like I said, we're not going to start applying right away. We're going to click on the button that says Get Coverage, top left of your screen. Once you get coverage, you can, once again, start an application right away. But we're going to scroll down to the See Plans and Prices. It's the third blue box on the bottom of your screen where you're going to be able to start previewing some of the plans that are available. So Ryan's going to identify a zip code, and this is how you get started. You're going to pick your region to see what plans are available. We're picking that we're in the Madison area. Dane County, are you enrolled in a marketplace health plan? We're going to say no. If you had a plan in 2016 and you want to see if it's available for 2017, you would click yes and see if that plan still exists. We're going to pretend we're a brand new customer. Who is applying? Is it just you, or are there other people in your household? And let's call ourselves Ryan today. So we're going to say it's just Ryan. And Ryan's going to start telling us a little bit about himself. Now you notice, and you can take care of the mouse, there isn't too much detail here, but it is just enough to get started. And Ryan, why don't you talk us through how you're answering these questions?
Sure. So I'm 24 years old. I'm a male. And then it asks here for some other information. Could we kind of clarify maybe what these...
Sure. So it's going to ask if you're eligible for health coverage through work or through another program. This is actually asking if you have access to minimum essential health coverage. If you answer yes to any of those, you're still able to buy marketplace coverage. You might not be eligible to get tax credits, however. So answering these questions accurately is going to impact the price of the plans you're going to see further down in this shopping.
Okay. For the sake of this example, I'm going to leave those blank, and we'll click Continue. Now, if you notice, all the continue buttons are in green. So if you just keep clicking on these green buttons, you're going to find your way to the end eventually.
So it's confirming you can change any of the information. It just as if you're shopping for sweaters or anything on Amazon, you're going to notice it's a very similar format, which makes it user-friendly. So this is a way, if you're working with families and consumers, to kind of demystify the whole shopping experience. It is rather user-friendly, a big change from 2013. So this keeps getting better. Here we're going to estimate your household income for 2017. Now this again is a projected income. So Ryan, go ahead and pick an income.
We'll do $30,000.
And it is annual that you're typing in here. And the advice to folks when they actually are applying is to be as accurate as possible with your guess, knowing that it is a guess. Folks will have to reconcile the difference later on their taxes if their guess was off by a significant margin. So we're guessing $30,000 will be our income next year. Go ahead and continue. And it's going to start showing estimated savings and tax credits right away. So it said based on what Ryan typed in for his household, for his age, and for his estimated annual income, it looks like you're going to qualify for some tax credits, and it's going to be on the order of about $13 a month. So we're going to keep continuing through this shopping experience. And it's going to see... You're going to be able to see lots of things this year when you're shopping that you weren't able to see last year when you're shopping. Not only are you going to get an estimate of your yearly premiums and your savings, like it just showed us this estimated tax savings, you're going to also get an idea of deductibles and any co-payments or co-insurance, any other costs that are associated. This is really nice feature because you might see plans that have really low premiums. And then once you dial in the past, you would see, oh my gosh, it's a huge deductible plan. Now the way that the material is presented in Healthcare.gov is to be able to lay out all of the costs so you can anticipate what expenses you might be responsible for beyond monthly premium payments. So this screen that we're looking at right now is showing us the format it's going to appear on future screens, but it's going to ask us one more question. It's going to ask us if you anticipate you'll be a low, medium, or high user of medical care. Now, this is helping to give you that estimated out-of-pocket costs on things like copays and deductibles. This isn't going to impact costs of the plan or premium that you're going to be responsible for each month, but it's going to be a little bit more accurate if you're someone that goes to the doctor quite frequently, then your out-of-pocket or copay might be a little bit more. So that's why it's asking you this. So let's say we're a medium user of healthcare. We go to the doctor a little bit more than the average consumer, but we don't have a lot of prescription drug cost. You can start entering some information about your network. This is where folks that have a specific doctor in mind or a specific pharmacy might want to type that in and see if their doctor that they have now is in one of the plans that is participating. We're going to skip that step. We don't want to take too long in this little drive-through demo. You will then see, once you've answered the questions, it's always going to give you an opportunity to correct your information, make edits. Once you see it in this format, you might say, oh no, I think I do want to go back and add my doctor. Yeah. You have an opportunity to change some of those questions. And then we're going to continue right on to the plans. Now, once again, it's showing you with this pop-up that comes up, you're going to notice a lot more pop-ups this year than there were last year. It's giving you extra features. You can hover over some things to see what they're actually asking. When they say the word deductible, you can hover over that and it'll tell you what that means. You can filter plans. You can narrow your searches down. Say you only want to see silver plans that are available. You can actually filter. And then there is the compare and save. You can pick up to 3 plans at any given time and put them side by side. So you can actually do an apples to apples comparison. So these new features are actually a lot more user-friendly for folks that want to narrow down their options and they're not exactly sure. A second pop-up, once you hit continue, is reminding you that there are qualified health plans in the marketplace that are organized by metal tier. And those are, bronze, silver, gold, and platinum. There are also catastrophic plans. Because Ryan typed in that he was under age 30, some of the options that are available to you in this next preview step may be catastrophic plans. Those are those that are a little bit lower monthly premium but higher deductible that cover, for young invincibles, just some of the bare bones but still essential health benefits. We're going to click through next. This was a good reminder of what some of our options are for metal plans, and you can do one more filtering. You can see simple choice plans, or you can see all plans that are available. Now, we've got all the time in the world, so we're going to see all plans that are available because we really want to get a good comparison of what's going on. Now, you will be told up here how many plans are actually available in your region. We started with the zip code. It tells us that we have 75 plans we can flip through. Now, if we wanted to start filtering those, we could sort by premium, we could sort by deductible, we could sort by if we want a health or a dental plan, and we could continue to refine our results. We can see as we just slowly scroll down here, there are a number of plans available. Like they told us, we're seeing our premium, our deductible, our maximum out-of-pocket cost, our co-insurance, our estimated total yearly cost, and then we could edit and actually then see if our doctor participated in that plan if we typed in that one. So like we said, because you're a young invincible, we're seeing some catastrophic plans. The more we scroll down, we're seeing bronze. You can sort by metal tier if you wanted to just see all of your silver plans. But let's say we're interested in this one. We like that it's a low premium, it's a little bit higher deductible. We want to do a quick view of this plan.
With massage therapy.
What's not to like? This is going to be your plan.
That's great.
One of the new features as well, you can see there's a lot of information. This is just the summary. We didn't even click on the detailed view, but so much more information is available this year than last year. One of the documents that I'm going to hover over right here, you can actually see an actual summary of benefits for this plan. It's been uploaded and it's available right on the website. So there are new features. This one's loading, so we're going to let it do that, and we'll be able to look through that summary of benefits. Okay, so once you've viewed your summary of benefits, you can actually close out of this pop-up view. And let's say you really liked what you saw. you can actually click on the enroll button after you've done your comparison and say, I want to enroll in this plan that I like. Now, if you didn't want to enroll right away, you could actually just write down the name and the number of the plan that you found that you'd be interested in. Do all the rest of your app applying later, but make sure you write down accurately that the digits, the name, the bronze, silver, platinum, the metal tier, write all of that down. It'll give you a plan identification number. Write that down. Then when you go shopping later, when you're actually going to apply for coverage, you've got that ready. You don't have to go through all of this again. You can just type it in and pull up that plan. If you wanted to just enroll right from your window shopping, you would click on that enroll button, and it's going to then prompt you to create an account and then start your actual purchase all in one step. So allow about an hour and a half to do this. You've done your pre-shopping, you're organized, so it shouldn't take you that long, but allow a block of time that you can do this. Now, if you do get called away, you did write down a username and password that you're going to be creating when you set up an account, so you can log out and log back in, and it'll remember you. So you're going to create a little secure account, write down your username and password. You'll need that later if you log out and come back in. That's a very quick window shop for Healthcare.gov. We hope you make it through without too many incidents. There is help in your area if you get stuck or you need to talk it through. Healthcare.gov also has a 1-800 call number that you can call at any time. Now, it is their busy time. They just open enrollment, so be prepared for a little bit of a wait if you do call. But that local help in your area, which you can find also on Healthcare.gov by clicking on Find Help in My Area down at the bottom of the screen, will get you closer. There are navigators throughout Wisconsin. We have those listed on our website. You can visit those at any time as well. Thanks for joining us for this quick walkthrough of Healthcare.gov.